The broadcast of the regular meeting of the Budget Committee will now begin.
Good morning. My name is Lene Palmisano. I'm the chair of our Minneapolis Budget Committee, and I'm going to call to order this regular committee for Thursday, October 8th. Before we proceed, I will note for the record that this meeting has remote participation by City Council members and City staff, as authorized under the provisions of Minnesota Open Meeting Law, Section 13D.021, due to the declared state of local public health emergency. At this time, I'll ask the clerk to please call the roll and verify the presence of a quorum.
Councilmember Reich.
Here.
Gordon.
Here.
Cunningham.
Present.
Ellison. Osman. Goodman.
Present.
Jenkins.
Here.
Kano.
Here.
Bender. Schrader.
Here.
Johnson.
Here.
Fletcher.
Here.
Ellison.
Present.
Osman. Bender. Chair Palmisano.
Present.
There are 11 members present.
Thank you. Let the record reflect that we have a quorum. Today we will begin hearing presentations from city departments on the mayor's 2021 recommended budget. On the agenda today is the police department, the fire department, and 911. Let me just explain a little bit about how I see this working. As chair of this committee, we have set out up to 90 minutes for MPD, knowing that there's great interest. We have 30 minutes for the fire department and 30 minutes for 911. If we don't use that time, we are asking and we are working behind the scenes to get those next presenters up so that we can run this smoothly and perhaps adjourn early when that makes sense. We don't have Micah to lead us off on a presentation today, though he is here to answer questions, but you won't be hearing a preamble from our budget director or our budget staff. As usual, put yourself in queue if you have a question, and I will pause the presenter. Next place I think it makes sense, and we can go to your question or your comment. We do have the schedule. I sent out a link to the schedule, and it's posted on the city website about the budget. Some of those future presentations, meaning different departments, might need to change. We think we have them all locked in, but there's always just, human needs to change some departments presenting at some times, and because they're not at the same amount of time, that gets tricky, and so other things move around too. So this is our first day with MPD, Fire, and 911, and I will recognize Chief Arredondo to please kick us off. Welcome, Chief.
Good morning, Madam Chair and committee members. Thank you for having me here before you today to present on the Minneapolis Police Department proposed budget for 2021. Tex, if I could please start out with the first slide. Okay, Tex, if we could go to queue up number 16 first.
It sometimes takes a minute here, Chief.
Yep, not a problem.
Oh, that's the fire department. As we are waiting, I'll point out that colleagues, you were emailed all of these presentations today from the city clerk, from Casey Carl. They are in your email inbox, and for the public, they're also posted online on our LIMS files. We will be trying to get it up so that people viewing this on live feeds will also be able to see it, but it is also posted in those other places.
All right, Madam Chair, committee members. I wanted to at least start out the first part of this presentation by giving an overview of our general fund expense comparison from 2020 to 2021. And this slide is noting the MPD's 5 basic core functions. And as we see, there are from 2020 to forecasting to 2021, we will have projected decreases in all of those 5 main core functions. So for public safety services, the total 2020 FTEs budgeted were 604, and for 2021, the proposed FTEs will bring us down to 531, which is a 12% decrease. And public safety services would be our 911, our core 911 responders. Investigations and forensics, 2020 had FTEs budgeted for 226. The proposed 2021 FTEs funded will be 191, which will be a minus 15%. And for our professional standards, development, and administration, that is our MPD's training core components, our training, our internal affairs, recruitment, those core functions, and hiring personnel. That goes from 2020, 131 FTEs to next year proposed 112, so it's a 13% decrease. Our community collaborative and advancement, 2020 saw 74 personnel. 2021 will bring us to 58, so a negative 22 decrease. And then our special operations and intelligence division will go from 47 FTEs budgeted for 2020 to 44. All right, Tex, if we could go back to first slide. We'll start with the summary chart. Madam Chair, committee members, so as we look at the overall funding distribution for the Minneapolis Police Department, you will see that core public safety services will encompass 56% of our funding. Next, we will see our investigations and forensics with 21% absorbing the funding. Next will be our professional standards and administration with 13%, and then 5% distributed between our community collaborative advancement and our special operations. The core thing to take away from this slide, Madam Chair, committee members, is that with the reduction in MPD staffing and resources, this will really, I'm streamlining our department. It's really something that I'd rather not do, but it's going to focus on being one-dimensional. and that is really going to be focusing on patrol and investigation. So as we continue to see decreases in resources and staffing, my core responsibility to all of you and our 400,000 plus residents will be that if that person picks up the phone to call 911 and needs a patrol response, assuring that they receive that, and then making sure that our victims, if we have victims of crime, that their cases are investigated. And so that is really our core focus as we move forward with the projected decreases in staffing and resources for 2021. Next slide, Tech. Madam Chair and committee members, the MPD is committed to maintaining our core functions of public safety services of 911 response and investigatory services. In response to significant and unpredictable attrition and budget decreases due to revenue shortfall, the MPD will be decommissioning or deactivating some of our non-mandated units in order to move sworn staff to those priority functions that I previously mentioned. As a result of this will result in a loss of function in terms of our service in some areas in order to maintain those core public safety services that are vital to the community. Maintaining target staffing levels will be challenging due to significant and this unpredictable attrition that I will speak about later. Next slide, please. So what does that look like in terms of our MPD-based cuts regarding those public safety services? And this now will be focusing just on our 911 patrol response. So this will obviously have reduced capacity for the MPD. The FTE reduction, or the full-time employee reduction from 2020 to 2021 will have a net loss of 73 personnel. As mentioned before, that goes from 604 back in 2020 that was budgeted to 531 projected for 2021. Payroll and fringe savings of this reduction will be about $8 million. However, that will be offset by an increase in overtime of $3.5 million, which partially covers capacity reduction. While as we lose more personnel, that will mean requiring those remaining personnel to take on additional overtime to serve those shifts. But there is also a human and financial cost to that overtime. What this will also bring about will be a longer response time at our current crime levels. We are experiencing at least 5-year levels in violent crime that we've seen. We've peaked, doubled our homicide rate from this same time last year. And sadly and tragically as well, our victims of gunshot wound violence is over 400, and we may even peak to 500, which is absolutely devastating to our city. With our men and women having to respond to those types of violent calls with reduced staffing, that means they're going to spend more time on those calls, which will mean that response time to other lower priority calls will obviously take effect. Structural changes, I've mentioned before that we have deactivated certain units, and as we, if we continue to see greater attrition, there will be more units that will have to be deactivated so that we can maintain the service levels for those 911 calls. So some of those units that have been decommissioned are community response teams, which means that we'll have limited resources to livability issues, property crimes, neighborhood beats, and others. That means we'll also be limited in our proactivity due to those unfilled positions. We are also seeing some reductions in our crime analysts and our crime prevention specialists, and we've had obviously a hiring freeze for the time being.
Chief, if I could just
Yes.
pause you. We have a couple people in queue. We'll start with Councilmember Fletcher.
Thank you, Chief. I have a couple questions on this slide. The first one is I note the FTE reduction from 2020 to 2021 looks dramatic, but then at the same time in your presentation a couple weeks ago, you indicated a similar level of patrol officers assigned because of some of the reallocation that's happened in other places. And so I guess I'm wondering, my impression is that what was budgeted in 2020 that you're basing that number on is not a number that was ever achieved. or that was actually happening on the street in any way that people would feel. So can you talk about what kind of actual staffing level in terms of number of sworn officers assigned to patrol you're proposing? Is it a change, or is it a significant change in terms of the number of people actually assigned to patrol?
Madam Chair, to Councilmember Fletcher, so if I'm hearing you correctly, in terms of a change, so we had more units that were activated last year at this same time. And so we were maintaining or keeping those staffing levels at each of the 5 precincts. With the attrition and the significant attrition that we've seen so far year to date, I've deactivated some of those units and placing those bodies back down into the precinct. So if that answers the question.
Got it. But in terms of precinct level staffing, it's not an especially dramatic change. That's actually been fairly static.
Yes, we're committee, Madam Chair, to Councilmember Fletcher. So yes, we're, in terms of the precinct patrols or patrol staffing, it's kind of a, how can I put it? The department is shrinking. That is true, and that is significant. And with that shrinking, I'm trying to just make sure that again, we're going one-dimensional into patrol and staffing. So so yes, we're trying to maintain those levels at the precinct, but the department as a whole is decreasing in size.
So, Chief, may I add a comment?
Director, go right ahead.
So I don't want to preempt you if you're going to be talking about capacity or not, but I think one of the things, and I can't address specifically at patrol, but I can address capacity for the entire department. And at the current rate that we are right now, with 118 that we're showing for next year as a reduction, that ends up being a little over 200,000 hours of workable hours. So if you take the number of hours total of 2080 that most people work during a year, and you take out vacation, and you take out sick leave, and you take out training, you come up with approximately 1,750 hours per person worked, 1,750 to 1,780 in our department. And if you multiply that by the 118 people that we will be down in sworn personnel, you come up with a capacity loss of over 200,000 hours. If you divide that by the number of 8 hours, assuming an 8-hour shift, and some of our officers have 8 and some have 10, that's basically 25,000 shifts during the year that will not be filled. So those are real numbers. Those are real. That's real time. If you look at what the leave hours were for May through, I think it's October 2nd, that's about 45,000 lost capacity hours. Using September, that also extrapolates to about 200,000 hours. So the loss of 25,000 hours or 25,000 shifts in a year is pretty significant. Now that is spread throughout the department. And as the chief has mentioned, we're trying to move as many people into patrol to compensate for that. But ultimately that will have an impact, and it is a significant impact. That's all I have.
I would agree that breaking it down to the smallest possible unit makes the change sound as dramatic as possible. Chief, one other question that I have, I wonder if you can speak to overtime. And I think that that's going to be important for a couple of reasons. One, obviously, for all of the reasons we've talked about health and wellness, about officer effectiveness. We want to minimize overtime. I'll note, and this is probably more a question for Micah than it is for you, Chief, but I'll note that the way overtime is currently budgeted in the mayor's proposed budget is in violation of our financial policies, if I'm reading them right. And so I want to just make sure we've got a very strict financial policy against budgeting for that percentage of our staffing to go to overtime. So I want to confirm that that's true, but also just knowing that we're going to have to clean that up, that we're going to have to find another way to account for the capacity that you're attempting to build in here if we're going to, in fact, support that capacity being built into the budget. I think it's important for us to understand why you're thinking about such an increase in overtime, and is that more related to unpredictable events that you want to budget for just in case? Is that the standard day-to-day overtime of arrests getting made at the end of a shift? Is that other kinds of capacity that you've identified that you think you're going to need? But can you help us with just a little bit of narrative about why so much overtime and how we should be thinking about that as we think about how to budget for it in a way that complies with our own financial policies?
So just before before MPD responds, I'm going to ask our budget director, after you're done giving us a little bit more narrative, to explain the regular process and what we do, how we budget essentially for overtime through our regular budget. I think that's more of a question for him, but the other ones, I invite you to go ahead and give us more information if you want.
Chief, perhaps we should start with how overtime has been calculated, the increase, and then if you can go on with the remaining questions that Councilmember Fletcher has asked. But the overtime increase was calculated based on the lost capacity. If we were to budget 100% of lost capacity, I believe that number is like $15 million. Obviously not something that the city or the police department or too many people could afford. So the capacity that we've covered, or the capacity that we're asking for as part of this budget, covers approximately 28 to 30% of the capacity that we are losing with those 118 officers. Chief, that's all I have. Thank you.
Okay.
Thank
Chief, did you want to add anything, or should I turn it over to the budget director?
Madam Chair, to Councilmember Fletcher, I was just going to say that overtime, certainly within the police department, covers a wide range of different uses. Some of those certainly can be large-scale events. Some of those can be unpredictable events. Some of those can be staffing shortages, covering for that. So we always try to build in that a sense of overtime budget for each year, because we know that we're typically, obviously, we're gonna need that, and so so it varies.
Thank you. And then Micah, Director Intermill, would you like to add anything about generally how we budget for unpredictability in policing, or anything like that that Robin didn't jump in and add?
Certainly, Madam Chair and members, happy to be here today. Micah, Intermill Budget Director. So the way that we budget for the police department, same way we budget for all other departments, and that is we, I talked a few weeks ago about our current service level setting, and that current service level setting, the inflationary factors that we include for our personnel budget does not contemplate overtime. Overtime is paid for through that sort of non-personnel base. And so in our 24/7 staffing operations, such as police, fire, 911, they recognize just very much to what the chief just said and to what Director McPherson just said. There are needs for overtime just to be able to fill shifts. Councilmember Fletcher is absolutely right. We do have a financial policy that indicates we shouldn't be budgeting more than 5% of salary and wage for overtime costs. I was not here at the city, nor was our current CFO or deputy CFO or city coordinator when that policy was developed. So I can't really explain the specific rationale and the thinking at the time. I think that certainly what we've just heard from the police department is that circumstances, at least in the department's estimation, would require more overtime than that policy would allow for. And so it's probably, this is actually exactly why we have these meetings and why it's really good that we've got council engaged in looking at our financial policies. So I think it's a good conversation to have, and we always have the opportunity to amend those financial policies if the current situation calls for something different.
Thank you. We've got other people in queue and we want to get to the rest of this presentation. So I'm going to call in Council President Bender and then Councilmember Gordon.
Thank you, Madam Chair. Hi, Chief. I guess maybe I'll make a comment and feel free to answer it as a question as well, Chief. I've been reflecting on kind of how we adjust all of our city services in the reality of the pandemic. And just today, Target headquarters announced that they won't be having workers in downtown until the summer of 2021. And I know that our downtown usually has over 200,000 workers commuting every day. We usually have 30 million visitors to our city who are staying home because of the pandemic. And I also know that the pandemic and the various impacts of it are increasing things like drug use and overdoses. We're seeing particular kinds of violence increase in a very troubling way. And to me, the most very troubling thing about it is the number of young people who are involved in everything from property crime to losing their lives to violence, and it's unacceptable. But when we think about our resources, we have these very dramatic shifts where we have significantly fewer people coming to work, coming to school, our entertainment venues are closed. So, I just wonder if you're talking with other chiefs around the country to understand how these different trends are affecting our need for investment in safety. In some ways, we're becoming more like a residential community that may not need as much policing, in downtown during the day. On the other hand, we have these other factors in place, of course, that are creating particular types of issues in our community, again, particularly for young people. And as you know, I think we've talked about a million times, we both agree, we all agree that policing isn't the only solution to these issues. Of course, if we can catch young people, before they're victims or perpetrators of violence, if we can interrupt these cycles, we're doing much better as a community. So feel free to take that as a comment for follow-up. But if you do have any insight into what chiefs around the country are saying in terms of these commuting patterns shifting so dramatically and the entertainment venues being closed and likely now for many months of the 2021 year ahead.
Madam Chair, Council President Bender, thank you for the question. And so, yes, I've been in conversation with some of my peers around the country who've been also experiencing, particularly this year, high rates of violent crime across the country. One of the things that, and I think that will definitely all be in terms of public safety, we'll be looking at this 2020 year and studying it for quite some time. But one of the things that is clear is that operating under this pandemic across the country, and certainly here in Minneapolis, has been unique. Many places across the country, including Minneapolis, obviously, we've seen unusual increases or spikes in violent crime. So even with a large majority of our workers working remotely, even with schools for the most part either being closed or students working from home, we are still seeing this violence played out in our communities. We certainly know that all cities, including Minneapolis, which all of our elected officials here are trying to do in terms of look at our fiduciary responsibilities, the impact of COVID and civil unrest. There are a lot of people who are out of work in our cities and cities across this country as well. That could be playing out in a part of this here that we're seeing in terms of violent crime. We know that things such as domestic assault has not decreased. We certainly know that the addiction issues and the narcotics issues that you've mentioned, that is still playing out. So We've had over 400 people shot and wounded in the city. So, so even though there is a core group of people that are not doing those normal things, coming into downtown off a light rail in the morning hours, and a large group leaving to go back home, and our downtown venues, many of them not opened, it hasn't changed in terms of some of the things that we're seeing played out across the country, and certainly here in Minneapolis as well. So again, I think that a lot of us around the country, certainly in policing, are going to be studying 2020, the impacts of the pandemic, some of the civil unrest that has occurred around the country, the economy that everyone has been grappling with. And so we're just trying to do our best to certainly keep our city safe here.
And I think that's why it's so interesting and valuable that we've been digging so much into our 911 data, is to understand, what % of our calls are for violent crime, so that as we see our population dramatically shift and the number of people coming into our city each day down, by hundreds of thousands of people, to really understand how those trends are impacting the other needs, the nonviolent calls. So for me, shifting resources to focus on violent crime is a very reasonable thing to do. To have our police focused on addressing and hopefully working in partnership to prevent violent crime. And so, I think in the past, our numbers of calls coming in related to violence, thankfully, are very low as a total percentage of the calls that are coming into 911. We've trained people to call 911, for all kinds of reasons. That's what our, staff have been telling in our neighborhood organizations for many years in meetings: call 911 if you see anything, say, so we have a lot of people calling 911 for reasons that are not, again, thankfully not related to violent crime. So digging into those numbers again for 2020 and looking to see how this dramatic drop of daytime population and nighttime entertainment activity has affected why people are calling 911, I think will be helpful in guiding some of these decisions. Thanks, Chief. I know there's others in queue.
Thank you. Emma Kawala and Councilmember Gordon next.
Thank you very much, and appreciate getting this information. I just wanted to zero in a little bit on this slide in terms of the crime analyst and crime prevention specialists. I think those are really important roles and positions, and it says there's unfilled positions. And if you don't know or don't have the information now, that's fine. But I'm curious about how many unfilled crime analysts and crime prevention specialists that we have. And also, I'm curious in the org chart where they fall under that. Is it with public safety patrol services and through the precincts? And I'm happy to take the answers later, but if you can provide a little more information now, it would be appreciated.
Sorry.
Chief, I can answer that. I will have to, Councilmember, I will have to give you a call later and give you exact information. The crime analysts that are open in this position are, I believe there are actually 3 of them, and they are out at the precincts, and that is an area that we are concerned with. The crime prevention specialists, I believe there are 2 that are currently on the freeze list, and again, those are out at the precincts as well. But I'll confirm those numbers.
Just to follow up, is the from my impression, and Ward 2 has 3 precincts that serve it. We have 1 crime prevention specialist for each precinct, and then maybe we also have some more citywide ones. So could I just get a picture of the total number that we generally aim for and coverage? Sure.
We have actually 15 crime prevention specialists. Some of them are paid through the CDBG block grant, and some are paid through the general fund. For the most part, I think with the exception of 2 of them, they are all out at the precincts. And then the crime analysts, I didn't answer this, but the majority of the crime analysts are actually out at the precincts, but we do have a couple that are, one is in, or 2 of them are in investigations, and I believe that we have 1 also in special operations. So those are a little scattered.
Thank you very much.
Thank you. Councilmember Councilmember Goodman is next.
Thank you, Madam Chair, and thank you, Chief, for your presentation. I find the report somewhat alarming. I don't feel that it's taking into account the crime and safety issues we have generally and what I'm hearing from my own constituents. I also find it alarming that the city council president, along with others representing downtown, seem to think there isn't a problem with crime downtown. All you need to do is talk to business leaders downtown who will tell you that their employees are afraid to come to work. They're afraid to walk from the North Loop to 8th and Nicollet. That is a reality. Their perception is the reality. We have 40 restaurants who have banded together to say that they can't get people to work in their restaurants, even when they are open, because people are afraid to come downtown. We have 50,000 residents living downtown, and they're often afraid to go outside because they hear sirens, helicopters, and they see all sorts of civil unrest right in front of their front door. So I feel like I had to say something to suggest that council members are not paying attention to what the business community has been telling us, and they're just brushed off as political. Restaurants have been telling us, restaurant owners and workers have been telling us, and they're brushed off as it's just a perception issue. Their perception is their reality. Do we want people coming back to work downtown? Because it seems like we don't. Do we want restaurants to reopen downtown? Because it seems like we don't. Do we care about whether or not there's people renting apartments and buying condos or living in housing downtown? It kind of feels like we don't, because if we cannot implement public safety in our city, people are going to flee and the tax base is going to suffer, and we're going to have a lot less money to do all of the things that we think we need to do. Maybe I'm just in my house in my own world hearing from everybody who thinks this is a problem, and you guys are all in your houses hearing that there's no problem, this is just a perception problem. For me to have to publicly say this in a budget meeting should indicate to you what I'm hearing from my constituents. And I do respond to all my emails every day. And what I'm hearing is people are afraid and they want more public safety, not less. And to minimize this perception issue and suggest that people aren't coming downtown, so therefore we would need less public safety, is ludicrous. We won't have people visiting our city, coming back to work, going to restaurants, unless people perceive that it's safe. And if they don't, everyone else suffers.
I will just take that as a comment. Councilmember Kano.
Thank you. Thank you, Madam Chair. Chief, thank you for this presentation. So my understanding is that the plan for 2021 is to start the year with the sworn staff level at 531, correct?
That is, Madam Chair, Councilmember Cano, that is correct.
Okay, and I share similar concerns as Councilmember Goodman in that, you know, I have a bike shop on the Greenway that's been robbed 8 times that refuses to open until the safety issues are addressed. I have at least 2 East African businesses that have been vandalized and broken into, one of them a daycare center and another one a furniture store. Jaquino's was also robbed and vandalized this past 3 or 4 days. The Latino businesses, of course, are very, very concerned and continue to be a target of constant robberies on Lake Street. So it's not a secret that this is happening. I would be curious, is there a way for us to get some of these numbers broken down into precincts? So if indeed we plan to start 2021 with 531 sworn officers, I would like to see the breakdown of how those officers are distributed throughout the city. How many would be in the 3rd, how many would be in the 5th and in the 1st and so forth. And then I would like to see the change item as well. You're very good at highlighting here that in 2020 it's 604, going into 2021 it'll be 531. I would like to see that same number breakdown in all of the precincts, and I would be happy to work with your staff to get those numbers and those details outside of this meeting. Thank you.
Madam Chair.
Yeah, I was just going to offer, I'm not sure you necessarily have that level of detail since the budget isn't adopted yet, but Chief, go ahead.
Madam Chair, to Councilmember Connell, yes, I'll try and work with Director McPherson and see about that specificity that you're requesting.
Thank you. Council President Bender.
Thank you, Madam Chair. I put myself back in queue because apparently my comments were confusing. So I just want to clarify that we have significant shifts in all kinds of patterns in our city due to the pandemic and the economic crisis. And we appear to have no help coming from the federal government for the rest of the year. I think it is important to use data and information to make good public policy decisions. I think it's important to understand how the dramatic drop in commuting to work and to school and the closing of our entertainment values affects pattern of crime, as well as patterns of economic activity in our city. We should be using that information to make good decisions. I think it's really important that our police department be able to focus on the violence that's happening. Yes, perception of safety is important, but we have children dying in our city right now, and we need to be serious about interrupting these cycles of violence. And policing alone is not going to do that. The chief himself has told us that many, many times. And I've said this many times in all kinds of meetings with the business community that I've attended along with Councilmember Goodman, as she knows. We need to get serious about this. This isn't a political question and conversation. It shouldn't be. We have gang and group violence that we need to be serious about interrupting. We have 13-year-old children participating in escalating property crimes, and we need to be serious about figuring out how we can better support children who are suffering from a lack of support at school, whose parents are going through all kinds of trauma and difficulty right now, and we need to be serious about putting our resources together to support our community through these multiple crises. And that is something I have said consistently in private meetings and public meetings and everything I've ever commented on. So I hope we all agree that understanding how the pandemic and the dramatic shifts that it's making in our budget, in our community, and the patterns of people is how we're all making these decisions. I hope no one will disagree with understanding how the 911 calls are almost certainly shifting in our community, and we should all take the time to understand that and understand how we can support all of our city's departments in keeping our community safe.
Thank you. I'm going to turn it back to the chief now because I know that, Chief, you are at a training center off-site and need to eventually get back to the rest of your day here. We have several more slides for you to go through. This is important policy level conversation. I think perhaps we've veered off track a little bit, and some of those kinds of conversations perhaps could happen at a public safety committee, public health and safety committee in the future. But Chief, I'm turning it over to you. Help us get back on track with the rest of your department's budget proposal.
Madam Chair, thank you. As we kind of wind down this slide here in terms of public safety, the non-personnel impacts. So as a result of some of the budget reductions, we would see elimination for budget for repairs, maintenance and upgrades of precinct buildings, facilities and grounds, which could result in lower reliability, availability of equipment, or may increase future costs of deferred repairs. Also reduction in uniform and membership costs, which is some of that is required through contract, which could also include some things as telephone charges due to fewer FTEs. The next slide, Tex. So MPD base cuts as it relates to investigations, and I often really want to just highlight the fact that too often we sometimes forget victims as relates to community safety, and it's so important that we're doing our best, if someone becomes a victim, that we're doing our best to make sure that they have the best and proper investigation. So there would be an FTE reduction from 2020 to 2021 of 31. That goes from 226 in 2020 to 194 next year. We would see a payroll fringe savings of 4.5 million, offset by $1 million in overtime. That increase would be partially due to covering the capacity reduction. What this would do is this would move us from being more of a specialized investigation team to more of generalists. That would mean we'd start to spread our investigators around so that they could be more generalists, as opposed to just investigators that just simply do nothing but homicides, nothing but assaults, nothing but robberies or crimes against children. What that would also result in an increase in caseloads for the investigators. That would also obviously impact our victims and others. Could also impact on case prosecutions. The obvious human cost of overtime. Current caseloads would be a priority. Our open crime lab positions may result in a delay of evidence being analyzed and sent over for prosecution or charging. And civilianization of positions would be placed on hold. Some of the non-personnel impacts, deferred or eliminated software development and deferral of the crime lab server, as well as some of the other things I've mentioned previously, a reduction in uniform and membership costs required by contract. And so we would see reductions in our investigative and crime lab units. Next slide.
Chief, if I could pause you briefly,
yes.
Councilmember Fletcher with a question or comment relative to this conversation.
Thank you, Chair Palmisano, and thank you, Chief. Going back to the investigation slide, I just want to ask how you're thinking about that in terms of how you're allocating resources, because I think that there actually is a tension here, where the thing that you're doing is the right thing to get focused on solving crime, and that some of the ways that MPD's mission has spread over time that are the nice to haves are getting concentrated down. And I think as we think about the role of patrol versus the role of investigations, and those being the areas of real focus where that's really MPD's mission and MPD's sort of core function, is the right thing. I think that there's a tension in where we invest, and that tension is partially I think something you can hear in the comments of Councilmember Goodman and Council President Bender, in that if we are policing to perception, we probably want more patrol to have more visible presence. If we are policing to crime solve, we probably want more investigations. And so we're cutting investigations at a higher percentage than we're cutting patrol. And I kind of think we have it backwards. For me, I think investigations and actually solving some of these crimes, so that the crimes that are clearly patterns, the crimes that are clearly repeat offenders, are getting resolved so that there are fewer victims down the road. I think that's really the thing that's going to fix perception, is if there are fewer victims of crimes. And so to me, when you talk about what are the core functions of MPD, investigation seems like the place I'd be the least likely to cut, and it's the place we're seeing the deepest cuts. And so I'm concerned that we are cutting, but then at the same time also making ourselves less effective, even for the money that's getting invested. So I guess I'm curious how you're thinking about these investigations cuts, and if that's something that we might want to consider in the next couple of months as we continue to work on the budget.
Madam Chair, to Councilmember Fletcher, to your question. So I actually think there's another piece to this. So we absolutely need to have perception is real. And one of the more difficult things for me to quantify as a chief is a person's feeling of safety. And that does impact our role and our function. So the perception is real. Investigations is real. We sadly have people who are victims of crime, and that needs to be investigated. But we also have the real things, the real crimes that do occur, and we have to make sure we have a staffing capacity to respond to those as well. Because if we do not have the capacity to respond to those real crimes while they're happening in real time, that'll increase that perception negatively, and it'll also increase that's more caseload for the investigators. But the reality is, Councilmember Fletcher, is that we have to make sure that core 911 response is adequately staffed, because when that person picks up the phone to report that crime, we've got to have somebody there to respond to it. The other thing is that, again, investigations is key. It's important. But as we continue to shrink, if we continue to lose personnel due to attrition and other ways, I've got to make sure that we have enough people to initially respond to those crimes. So I think it's 3. I think that the perception, we have to deal with that. We have to make sure that we have investigators to investigate those crimes victims, but we also have to make sure that we have enough capacity and enough staffing to respond to those. And so I think we can try to do all 3. The perception one is very difficult to quantify, but what I'm told, where perception is, what I hear often about one's perception is, why did it take so long, Chief, to have a squad car? I called 2 hours ago to get a squad car there. This is the 3rd night in a row in Jordan neighborhood that we've heard shots going off, and it seems like it's on a regular basis. I mean, those are all things, and by the way, it's real. And so that's kind of what we're dealing with right now. I don't know if that helps put some context to it.
Thank you, Council President Bender.
Thank you, Madam Chair. Just to follow up on that, I mean, I think the 2 kinds of crimes we hear the most fear about are homicide and rape, and the solve rates for those crimes have gone down. And so I do think that making sure that we are able to follow through and have higher rates, I mean, those solve rates are very low, you know, over time really does, I think, really contribute to people's sense of safety and actual safety in our community. So I, you know, just want to echo that concern about cutting investigations at a time when our solve rates of the crimes that we hear the most fear about are down.
Madam Chair, to Council President Bender, one of the things we, you know, it's certainly not in this slide presentation, but the caseload of our investigators. You know, we certainly need to make sure that we reduce our caseloads for investigators, that they have enough time to work on those cases. But again, that core function of 911 response is going to be critical too. And so those are all things that I try to manage. But I think it's all 3. We have to deal with the immediate calls when they come in. We have to deal with those who are victims of crime, making sure that we're paying due attention and diligence in investigating those for them. But the perception, that is real too. And when I'm out in the different 4 corners of our city, people do need to know that we are going to respond, that we're going to be there, that the call times, that we're going to respond in a timely manner, that there's enough of us to manage those calls. And so I think all of this is very important.
Thank you, Chief. I'm not seeing anyone else in queue if you want to move on.
Sorry about that. The next slide, Madam Chair, committee members. This is our community and collaborative engagement. There's been reductions in that unit as well. So from 74 personnel down to 54 projected for 2021, a $1.1 million in savings. Due to reduction in staff and to maintain 911 and investigatory priority, this was a unit that we have decommissioned, and officers have been redeployed to patrol and investigations. And I should also just make note too, some of these decommissioned units have not all just gone to patrol. They've also been gone to investigations as well, because they're trying to keep, again, as it's been mentioned here, the importance of investigations. But redeployments will continue as needed based on future attrition. Some of those remaining units include primarily the backgrounds unit, our community navigators, our community service officer program that we're hoping to restart next year, and our chaplaincy program. But as I mentioned, some of those decommissioned units include our community engagement team, our procedural justice teams, and a loss of those units will result in a significant loss of community outreach as we continue to concentrate again on those core functions of patrol and investigations. Next slide. Special operations and intelligence. Our payroll and fringe savings have been due to frozen position offsets by overtime. As our public safety continues to evolve and due to the reduction in personnel, it'll become even more important for us to leverage technology and intelligence to address and predict crime trends and patterns. Future personnel reductions in our special operations teams could limit our ability to predict trends and patterns to proactively address crime and prepare for major events, including whether it's dignitary visits, sporting events, or other types of major or large-scale events that should arise. Some of the non-personnel impacts would be elimination of our TIP 411 software. We would still maintain our Crime Stoppers, and some of the milestone camera maintenance would be deferred, potentially impacting some of that reliability. Next slide, please. Our professional standards, administration, and professional development, we would see a reduction of 18 personnel, FTEs. The primary decreases in the training units, internal affairs, and records unit. The challenge will be if we are to proceed forward in 2021 with the hiring of 3 classes. We obviously need personnel to help put on those training academies. We would see a savings of 2.1 million, which would also be offset by 0.33 million. This bureau is pivotal to our spearheading of our transformational change, cultural competency, developing new staffing models, and implementing new policies and procedures. Continued staff reductions will result in limited ability to execute on those things that are so important.
Chief, if I could pause you there and call on my colleague, Councilmember Fletcher.
Thank you, Chair Palmisano. And if we can go back, actually, I was trying to get in on the special ops slide. Sorry about that. Chief, I wonder if you can talk a little bit, because the bullet points are, so on paper it looks like we're indicating a cut to special ops in general, but then the bullet points are at least describing a little bit of things becoming even more important that we need to do as though we're investing into them. So I guess I'm wondering if you can describe, are there new things that we're doing in technology and intelligence gathering that we ought to be aware of? It's no secret that that's an area of interest of mine that I'm working on ordinance around. So I just want to make sure that sort of, kind of within this, are there cuts or changes within the special operations budget that we should be aware of?
Madam Chair, Councilmember Fletcher, thank you for the question. So there's not any real major. The only thing I would say is if you look at the 2% reduction and the non-personnel impacts in terms of, so it's not as significant. This particular unit is not as significant. There is intentionality in this, knowing that if we continue to see the decrease or the attrition rates, we're just going to have to rely upon more things. We know that, for example, cameras, for example, downtown have been very helpful in us locating suspects in crimes, and there's many of them, as opposed to sending out 10 or 12 officers in an area to try to look for individuals who may have been involved in crime. So we absolutely are going to continue to utilize and leverage the technology that has been helpful to us. Primarily the camera systems have been so important and helpful to us. And as new technologies should present itself in public safety that are both important to helping with community safety and at the same time giving us that extra added tool that we don't have to necessarily dedicate human resources to. That'll certainly be helpful for us. And so to your question, the budget reduction for our special operations is not as significant as the other mentioned bureaus, but technology is going to continue to be very important for us as we move forward. I don't know if that answers your question.
It does, thanks. And let's make sure we're keeping in touch on the data privacy aspects of evaluating new technology as that proceeds. I also do want to ask about the next slide, if I may, before we move on, and then I see others in queue. I think so thinking about training, I think that the theory of change that I've heard you describe, Chief, in terms of culture change is really focused on this training as a really core and critical element of building a different kind of MPD. And so I guess I'm wondering how it feels counterintuitive if the ask is, if sort of the top line ask, it feels like for this budget is to make modest cuts kind of across the board, and then to invest in training new recruit classes, but then we're cutting training staff. So I guess I'm just curious sort of how you're planning on making sure or what impact you see that having on whether we have the ability to do the kind of transformational culture work that I think has been the theory of change that I've heard you articulate for the department.
Yes, Madam Chair, to Councilmember Fletcher. So we're at this predicament. If I can just be very candid, we're at this predicament where we are seeing significant challenges and certainly budgetary challenges and resource challenges to the Minneapolis Police Department. We're also at a space where we're trying to also make sure that we're ensuring the safety of all of our 400,000 plus residents, our businesses and visitors. And at the same time, I'm trying to make sure that I can instill that transformational change that we want to do, that is needed, that our communities are crying out for. But that's also got to be supported. I cannot, as your chief, even begin to have this transformational change if this work and this operation isn't supported in these areas. We're shrinking all over right now. I mean, again, as we talked about, investigations doesn't have the amount of investigators that it truly needs. The patrol, we certainly, and again, if we just simply look at those types of crimes that our policemen and women should be responding to, and I know there's a staffing study that's going to be done, but we certainly could use more in that regard. We also, at the same time, and I like to use both and, we need to support these other alternatives as well, whether it's violence interrupters and these other things. So it's all of it. I think we're at a point where we need to do all of it. If we go less on investigations, that's going to have a consequence. If we go less on patrol, that will absolutely have a consequence. We talked about the perception issue. So this is just the reality that we're in right now, and so I'm forced to having to, again, that one-dimensional. It's not one of the things that I'd want. I want to have the capacity and the time for our officers to get out there and have the time to talk with the residents in the neighborhood, not because they called 911, just because they pulled over and they want to have a conversation, that they can get over to Farview Park and have that conversation, or Phelps Park. Have time to walk into some of the schools when schools are back in session and read to kids. I'd love to. There were a lot of things that we have done, and we've done them greatly. We are just faced right now with challenges, quite frankly. And so at the end of the day, I have to make sure that we focus on those two core responsibilities, patrol and investigation. So.
Thank you. I don't want to cut off this debate. But I do want to just mention to my colleagues that I'm guessing we're about halfway through the chief's presentation, which would have us at this point in time needing to push one of our other presentations. And I would ask if everyone else could please mute their microphones, because there seems to be some hand percussion going on in the background or something. Thank you. Go ahead, Chief.
Thank you, Madam Chair. So I think we're on to the next MPD base cuts here. So the non-personnel impacts of this would a budget reduction for computer related supplies and some licenses. The impact could also delay our upgrades to our investigators, their desktop computers, also to coincide with the move to the new building. Our current desktops continue to be an inefficient tool for the limited number of investigators we have. An example of that would, for example, our sex crimes investigators. Obviously, it's very important work. Much of the evidence that they receive is digital platforms or video platforms. Their current desktop assets or operations is not real conducive to this. It's a backlog. It bogs down time. It creates length of time in terms of them getting back in touch with victims. It also obviously hampers sometimes with making sure that they get the cases properly prepared and sent over to our county attorney's office. So we also deferred software development to enhance data extraction from our CAT to PIMS would also be impacted. Funding was also to be used for scanning documents for archiving due to the new move to the building, which will be happening soon. So a portion of this project would be deferred. We've already a reduction in external travel and training of $60,000, primarily related to leadership training, and training related to travel will be restricted to required training only, so that folks can maintain their certifications. Offsets due to increased training costs due to additional hiring beyond plan, and a reduction in overall supply budget in all departments with the exception of our crime lab. So those are just some of the impacts, non-personnel impacts of that. So if we can go to new investments, the co-responder. So new investments would be for the co-responder program would include $455,000 in ongoing funds to continue the program in all 5 precincts. $230,000 in a one-time funding to expand the program with an additional 2 teams. All of this funding would be used to hire 6 mental health professionals through our Hennepin County COPE, with an additional 1 professional hired with grant funding received by COPE. The purpose of this program, as many of you know, is to provide effective and compassionate crisis intervention to those in need in our communities and to truly keep them in their homes. The MPD receives over 5,500 emotionally disturbed person calls annually. And while officers have crisis intervention training, the co-responder program allows each team, the 1 officer and 1 COPE professional, to deliver comprehensive services to those with mental illness as they work with mental health professionals who can conduct assessments with greater knowledge of resources and availability. The breakdown, the pie chart there just shows those service calls back in 2019 broken down by each precinct.
Thank you. Chief, can you help me understand, I've always been excited about the co-responder program, particularly this one, which seems to entirely be the mental health co-responder program. I'm seeing you nod your head yes.
That's correct.
Can you help me understand how we've funded this program in the past? When you say we would hire Hennepin County professionals, does that mean that we are paying them for their work at the county? Is this a transfer of money to the county, or can you help me understand how we funded this effort in the past versus what this change is to how we're contracting for their services, so to speak?
Madam
Chief,
Chair, yep, go right ahead.
Yeah, Committee Chair, the use of the terms probably is misleading. As in the past, we are contracting with Hennepin County for their employees. That would continue, and that's how we've done this in the past with the contract. So they are contracted, and they are Hennepin County employees who are paid by Hennepin County. In the past, these have all been one-time costs. So what this does as far as new investment is concerned, it puts at least the support of the 5 precincts into ongoing funding. So does that answer your question?
It does. I know we've also had some conversation around how we perhaps contract with other mental health professionals and other mental health agencies to assist us with this specific co-responder model for mental health. And is that not in the proposed 2021 budget? I know, for example, one of our challenges with COPE has been COVID, and that the mental health co-responders won't join for these calls right now during the pandemic. And we think that there might be others that would. So is that part of this or not?
Madam Chair, this is strictly for COPE. I would have to bring in DC Waite, who I think would be the better resource, who could answer some of those questions about other agencies. I know that COPE personnel were used initially because of some specific either certification, resources, ability, and that's why we went with COPE. Whether that still exists or has changed or not, I can't answer that. But I'd be happy to get back with you and ask those questions of Deputy Chief Waite.
Thank you. That's fine to take offline. My interest in this is in building the most robust kind of co-responder program possible is all. Councilmember Gordon.
Thank you very much. And I think I'd just like to put out a request to maybe have a conversation at the Public Health and Safety Committee about this. I think this is an important topic. I think people are going to be really interested in how it's been expanding. And I've had lots of conversations with residents and others who want to see it work and work better. There's ideas about having the program maybe operate a little bit differently in terms of them being able to be a first responder to incidents. There's also some models folks that looked at of having mental health mobile units so that there could be a mental health response first, and then if backup is necessary, there'd be a police response. So I would just put that out there at a request and think that rather than having the discussion offline, it might be good to dig into this a little bit deeper at the committee level. And I'll leave it at that. Thank you.
Madam Chair, Councilmember Gordon, I think that would be a great conversation to have, and we'd be more than willing to do that at one of the public meetings. Thank you.
Thank you. And Director McPherson, the chair of Public Health and Safety, has also just agreed to take that on. From a pure budget perspective, do I recall this correctly that once upon a time we added in expansion of this in the budget, but we didn't put any money into it, right? We had a successful pilot that we said, let's roll this out citywide, but we didn't actually give it more resources. Is that also your understanding? And so this might be that ability to give it more resources?
I think the big difference, Madam Chair, I think the big difference is we started with a small pilot. It expanded from a small pilot to basically all the precincts, but most of the money that has been dedicated to it has been one-time funding, with the exception of some funding that was provided for a couple of squad cars and some facilities. So this is really putting it in on a permanent basis, I think, is the major difference, and then expanding it with the 2 additional shifts.
Super. Thank you for that clarification. All right, Chief, moving on.
All right, thank you, Madam Chair.
Oh, I'm sorry, before we move on, Councilmember Cunningham, you haven't had a chance to speak yet.
Yes, thank you. I'm saving my questions mostly for the end, but while we're here, I just wanted to ask about the 2 shifts. Are we clear about where those 2 additional shifts will be allocated?
Madam Chair, to Councilmember Cunningham. My initial understanding, and I will have to check back with our folks who've been working on this, I think they were looking at the precincts that had some of the highest call volumes. And so I'm looking at this pie chart right now, but of course, this was from 2019. But I believe they wanted to look at placing the 2 additional ones probably where the precincts that were having a higher volume of call rates, but I don't know if that's been firmed up or not, Councilmember Cunningham. So I can certainly get back to you on that. And I don't know if you had a question related to that.
Nope, that's it. Just wanted to see if it was going to be a data question. So great, thank you so much.
Thank you for the question. I also want to just point out to my colleagues that some of our interest in doing this one time in the past, or rather with one-time funding, was we were hoping to work between our different interjurisdictional partners, right? Part of this was hoping and in looking to work together with the county to perhaps both fund this effort. This is where we're at right now with this proposal, it seems. So I'll look forward to more conversation about this program in Councilmember Cunningham's committee. Thank you. Go ahead, Chief.
Thank you, Madam Chair. So this last slide focuses on our early intervention system. And the program goals for this is to focus on risk management and prevention based on employee performance, to enhance accountability and quality of supervision. Also to identify performance issues and provide those intervention options more real time. Support also for the well-being of our officers and to reduce problems that lead to costly outcomes. MPD data is currently housed in various different databases. The goal of this obviously would be to have some analytic software that could again track these different measures real time. Historically within the organization, we've relied upon supervisors and supervisors alone to try to track individual employees' performance, even if they were switching to different shifts, different assignments. How was that performance evaluation being transferred to the next assignment if the employee was having some performance issues? So having a good, robust analytic software to help do this and to be that extra set of eyes is very critically important. And other departments across the country have found great promise in this performance measure. And so our current Tableau is currently not is currently used to visualize data in dashboards, however, cannot store information, does not have predictive analysis capability, and the current tools do not allow us to track data sources or generate automated alerts or allow us needed to know access that can easily be adjusted when assignments change, as I was mentioning, an employee going from one assignment or one precinct or one division to the next, or maintain centralized documentation with real-time access. And so that is the ask for 2021. As I mentioned, the EIS system would provide a case management system with all phases of metrics, documentations of the issues, performance issues and processes in one stored place, provide supervisors again with that real-time access to data, improving situational awareness, recognizing and developing trends and the capability of responding timely and effectively. So I'll leave that there.
I'm not seeing any questions about the EIS, Chief. Colleagues, in general, we have about 10 to 12 more minutes for questions about this proposal as a whole or specific elements of it. Councilmember Cunningham.
Thank you, Madam Chair, and thank you, Chief, for this presentation and the conversation that's happened thus far. I have some high-level questions that really tie into what we're talking about budgetarily. So we've talked about it bits and pieces here, but I'm curious about high level, cohesively, maybe a little bit more. What is your plan as police chief to establish legitimacy in the police department? In what ways will you change how MPD operates and how do these budget requests align with that?
Madam Chair, to Councilmember Cunningham. So 3 years ago when I came in as chief, I thought it was very important and believed it was very important to have a vision and a roadmap laid out for every single employee, including our sworn and civilian. And in that vision statement, I talked about the values of this Minneapolis Police Department and what is going to be expected of us. I talk about the importance of trust. And I will tell you, I remember we had a conversation, I think, at our last meeting, and you said, but Chief, I think you said, I'm going to push back and I want change now. And what I can say is that we move at the speed of trust. And so I can roll out all the great policies and training initiatives, but in the end, we are going to be judged by that trust and legitimacy that we have with our communities. So it's going to be very important that all of us within this organization lean in, reach out, build those relationships one community member at a time, and build that trust. Now, some of the things that we have been doing, have been engaged in, have been on structural change, certainly have been on policy changes. We talk about sanctity of life. We talk about some of the policies that have recently been implemented. We know that of all of the things that we do in community, the one thing that has the most impact is our use of force. And so we've made broad sweeping changes as it relates to our use of force. That ties into not only the building of trust, but I would also say how that has a budgetary impact. You know, our budget tells our story. You may remember, Councilmember Cunningham, that when I came into my role, then former Mayor Betsy Hodges, so when we talk about reimagining policing, I was doing that 3 years ago before it was a buzzword. She said, Rondo, this is your budget. Are there any things you'd like to do different? And I said, yes, I'd like to have community navigators. And she said, how many would you like? And after I said 48, after she rolled on the floor laughing, she said, I'm not going to give you 48, but I'll give you 6. And I said, I'll gladly take them. And so many people don't talk about that. Many in the council don't remember that. But before reimagining policing was mentioned, I was doing that. No one told me to think about those experiencing homelessness in our community, but I did. And Lieutenant Grant Snyder has been doing that work for many years. Now, some may say, well, that's not your role. I say that we have a moral obligation to all in our community, and whoever can do that work in whatever space they can do that. We should not knock that. We should try to support and uplift that. Now, if there's others who can do it better, that's absolutely fine. But that is what we'll continue to do. I also believe, Councilmember Cunningham, that we have a moral obligation to make sure that our communities are safe, that our children are safe, that our parents are safe, that our elders are safe. I also believe strongly that we have a moral obligation to make sure that the men and women who are police officers, who are going into service, going into harm's way to take care of these community members, I think we have a moral obligation. I believe we have a moral obligation to make sure that they're supported, to make sure that we have enough investigators to solve those crimes against children who are harmed in our communities, to solve those crimes against victims of assault, of robbery. I believe we have a moral obligation to make sure that the men and women who are going out day and night to horrific calls, that they have the wellness resources to keep them resilient, to keep them healthy, and their families. And so this has been my direction from 3 years ago when I came into office, and this continues to be. It also means, you talked about legitimacy, it also means holding our men and women accountable. When our men and women fall short on the values and on the trust that our community has given them, they have to be held accountable. And that requires me to make sure that I'm doing that and standing firm on that. But it's also, and I don't want to romanticize policing. There are apps. This is a 153-year organization. There are broken edges within this organization, but at its core, I believe and I support the men and women who are out there day and night trying to do the best. We can continue to get better, and we will. And that will be through training, that will be through policies, but that will have to be through also building relationships. It's working with your core team members in OVP. It's making sure that we're force multipliers and trying to reduce some of the gun violence that our neighborhoods and our communities are seeing. It's trying to reach out and prevent and have positive interactions and engagement with our young people so that they don't have to make a bad choice and go down that wrong road. It'll be looking at things from a public health lens. It's going to be all of these things and more. I will also tell you, though, we have an opportunity here. I mentioned most of this presentation. Many of the slides talked about reduction in attrition rates. Through adversity, I believe there are blessings. We have an opportunity now that we've never had before in my time as chief to bring on new men and women who have the belief system, the value systems that embrace what our communities want to see, and public servants that view them as necessary, view them as valued members, and will continue to try to be their guardians. And I believe we have an opportunity. So I want all of our council members to know that we have an opportunity like never before. If we can hire, bring on new people, we can get them into a culture that supports our communities, that values them, that values the vision and direction that we need to go in. We will not go back. We will only move forward. We will never be status quo again. But I believe there's an important and hopeful future if we're going to restore hope and restore community safety to our city.
Thank you. Madam Chair, I'm sorry. I have some kind of bigger questions that I was waiting for. So I kind of want to. I know I only have a few minutes, but
You mean we can't just end on the silver lining? Okay, go ahead.
I got some more digging to do. So the question of legitimacy, I think, is a big one. And I hear what you're saying and understand, the various components. What you have talked about, so thinking about community navigators, those are non-sworn, those are civilian employees, right? When we talk about accountability, that's one component, which is a bigger conversation, I feel like. So like there's the culture change around hiring new people, but really we're not operating differently. We can have officers who, go out and hang out with kids in the park, but if those kids then go from 12 to 18 and they're getting, every time they're out, they're getting, shakedown and, like they're feeling like they can't trust the police, or folks on the north side don't feel comfortable to call the police, then we're not increasing legitimacy. And so a big part of the legitimacy issue for me is, when we think about policing, it's kind of like very big. We're trying to deal with crime and violence in this very big way. But what we actually know is that when you boil down the intel, when you get all of the information, pull it together, that it's actually a fairly small amount of people who are causing a lot of harm to a lot of people. And so I'm curious about, from an operational perspective, how are MPD resources being allocated and directed to focus on these specific individuals rather than casting a wider net to try to be able to stop the issues that we're seeing?
Madam Chair, Councilmember Cunningham, that's a great question. So I would say that we have seen changes. I came on, Councilmember Cunningham, in a time in policing where that theory of casting the wide net and seeing if we cast it over 100 people, if we get 2 that were committing offenses, then we call it a day. We're doing things much smarter today. We're having conversations that we never had before. When we launched procedural justice back in 2015, we never had officers in a room talking about race, talking about the impacts that poverty has on our communities. We've never had that. I'll give you a real example from your ward. Our 4th Precinct Community Response Team, under the leadership of Sergeant Mosey, they have done and continue to do over years phenomenal work. And they are going after, through intelligence, those few individuals that you mentioned that are causing the most harm in our communities. They don't get complaints because they're still doing it by treating people with dignity, professionalism, and respect. That may not have been the case 15, 20, and 25 years ago. And if they are, those supervisors, they're holding those people accountable. We're having more conversations with our community members in terms of how they want public safety to play a role in their part. So I do think that things have changed. Now, what I will tell you, because you mentioned they have the interaction with the child at 12 years old and then something happens at 18. What we fail to talk about is what happened in between those 6 years. Was that child in school? Did they get the job that they needed? We see, because oftentimes the conversation centers on, and I hear it, and we're not alone, Councilmember Cunningham, but police become the focal point at the initial start of the conversation, and they become the ending point. We don't talk about our society's role and obligation with those children in between those 6 years.
I just want to be clear that I'm talking about the 18-year-old who didn't do anything. So they had a positive interaction when they were 12, and then when they're 18, they're a part of that wide net that gets caught up. So, it's like kind of like that holistic, We feel
Absolutely.
good because we connected with the kids, but then when they get older, you know, like even if they're not doing anything, they're having negative interactions with the police. So I just wanted to clarify
No,
what
thank you for, no, Madam Chair, Councilmember Cunningham, no, thank you for clarifying that. And we that one interaction, that one at 18 that did not do anything, and that impacts all of us. And good police officers should call that officer out because you're impacting us. You're damaging our relationship the next time we have to interact with that young person, and the stories that they will tell about, and it's unfair. So we have to make sure that one of those bad interactions costs all of us. It does. And so we have to continue to make sure that we limit those the best that we can.
I think that one of the challenges that we have is that is fairly standard procedures and operating for how policing works. And I'm glad to hear that things are shifting under your watch. I'm very interested in having further conversations around police problem-oriented policing, because that has been demonstrated to not only lower, because it's very intentionally aligned with other strategies, so the community folks, social services, in a way that actually not only decreases crime by focusing very specifically on the particular high rate offenders, but then also increases legitimacy because of the fact that like there are decreased amounts of negative interactions. So I would love to talk more about that. And then my last high level question that I would like to ask, because really thinking about through the budget and how we are here now in our current reality, is what would you say are the long-term goals of this department, and what is your theory of change to get there? And for the public, theory of change is the activities and investments and the resources, how are those connected to the outcomes that you would like to see? So so what are the goals for this, long-term goals for this department, and what is your theory of change to get there?
Madam Chair, Councilmember Cunningham, long-term goals for me is to uplift this department, make sure that the men and women are sworn in our civilian, are supported for the enormous professional work that they continue to do. My long-term goal is also to make sure that we become that public safety agency that has that trust, that we're viewed as legitimate, that young people will look at us and want to aspire to be guardians of their community by being a member of the Minneapolis Police Department. My long-term goal is working collaboratively with as many stakeholders as we can to reduce violence in our communities, to see that levels of addiction go down, to see that children don't have to grow up in neighborhoods where they believe that gunshots have to be their normal. My long-term goal is that we can get to a place, chiefs of police, elected officials, can see that policing, if done right, is an asset to community safety, that we don't have to be entrenched in ideological ideas, that we can all believe that we need to protect our elders, that we want children to feel safe in their neighborhoods, that police will act professionally each and every time that they encounter someone, that they'll be treated with the dignity and the respect that they deserve. That would be my long-term goals, but every single day we are working towards that. Every single day we're going to work towards that, and we won't get caught off track. We're just going to keep focused, and that would be my long-term goal.
Thank you so much, Chief. I appreciate it.
And thank you, Chief, for expanding on that. We have one more person in queue. I do want to point out that some of the other things Councilmember Cunningham was talking about earlier, not your long-term goals, but about, you know, what about adding this? What about adding that? It is relevant to our budget conversation because my understanding is that would take more resources. And And so I want us just to be mindful of that, but maybe to bring that into a future public health and safety committee conversation. I'm going to end with Council President Bender, and then we're going to move on to the fire department. So fire department, you are on deck. Council President Bender.
Thank you, Madam Chair, and thanks, Chief, for all your work. I remember all the work that you've been doing for the time that I've been here since 2014, and have worked to try to support this more holistic approach that is more effective at keeping people safe. And I will say, I think it is a higher priority to interrupt these cycles of violence in our young people than it is to somehow shore up a perception of safety among very wealthy people in our community. If we have to choose, we should prioritize the safety of our young people above all in our community. That's my position. In my time in office, I feel that one of the sort of unsung change opportunities is around the structure of our government, and it doesn't grab headlines, and it's in the weeds. And but when we sought to shift how we're approaching street design in our city to really support safety on our streets and to minimize the impact of through traffic speeding down our streets, we've restructured our public works department to create a new staff team focused on that work. Our regulatory services department right now is undergoing a restructure of staffing in order to accomplish the goals of our renter first policy that is focused on the safety and stability of the people who are living in our rental housing that department is set up to regulate. And I suspect there are many things that we could do within the police department itself and across the enterprise to restructure how we are responding and supporting safety in our community. I think one example is the navigators that you talked about. I think another example is the homeless and vulnerable populations outreach team, which is very small, I think now just one person. And I really, when I imagine a future in our city that is safer, I think about how can we better create teams of staff who are deeply rooted in the community and know who was involved in what thing, and who can work collaboratively again to prevent especially violence before it's happening. And I think we can get there. I think there's a lot of opportunities to use resources better and to be more efficient with the resources that we have. So I appreciate your eye toward innovation and to thinking differently about how we can approach safety. This is the mayor's proposed budget. We as the council are frequently asked and told by stakeholders, including our charter commission, that the city council should use the police budget to force change or to implement the changes that we want to see in the department because the department doesn't report to us under our charter. And so I think that's why we're seeing so many policy questions in this budget compared to the others, because so often we hear the city council has authority over the police budget. So even though you don't have direct authority over the department itself, you should use the budget process to implement policy change. So I'm not sure how practical that really is in practice. It seems to be a widely held perception among folks, including, again, the Charter Commission, who repeatedly made that statement to us recently. So I think that gives a little context to why the questions went the way they did. So thanks again, Madam Chair, and thank you, Chief.
Thank you. I appreciate that this conversation also allows us to go back to previous conversations we've had in the past, like when there were community navigator positions proposed in our police department, and I often think back on that, and I often think, what would it have been like if at the time the Chief Arredondo had gotten 20 community navigators? How might that have changed where we are now? And we won't ever have the answers to those questions, but I think it's important to look back and to take those clues from the past, to take a look at the way that things have worked and that things haven't. So thank you for this discussion, Chief. I appreciate your being here, along with Director McPherson. Thank you for your time. Next up, I'll just give people 30 seconds to kind of switch gears here. And Chief Friedel, can we hear you? Can we see you?
Morning, Chair Palmisano.
Hello. There you are.
Here we go.
Chief, are you giving this presentation, or are there others that are presenting with you or might jump in as needed?
Myself and Lou Scardili, my finance director.
Super, thank you. I'm going to ask us all to switch gears and just try to keep on going here and work through our fire department conversation. Welcome, Chief Friedel.
Thank you, Chair. Thank you, Chair Palmisano and committee members. Again, Chief Friedel, and I'm proud to say I'm still the chief of the Minneapolis Fire Department for a short time. And I'm here today to present the 2021 Mayor's recommended budget. I'm also joined by my finance director, Luke Scardili, who I'm going to ask to go through some of the details of the 2021 recommended budget and some of the impact of the department. Luke and I have worked, probably the last 8 years on the budget every year, so I thought it'd be being my last one that I'd like to have him participate. That'd be possible. So, if your permission, I'm going to go and hand it over to Luke and talk about our 3 base programs we've had for a number of years. That's fire suppression and EMS and technical rescue, community risk reduction, and also our training and recruitment. So, if that'd be okay with you, Chair Palmisano, I'm going to turn to Luke Scardili, and then we will both be standing for questions at the end of this presentation.
Thank you.
Thank you, Chief. Madam Chair, members of the committee, my name is Luke Scardili. I'm the finance director for the fire department. Thank you for allowing me to speak before you today. If we could go to slide 2 of the presentation, please.
Is it up for you, Luke?
It is not.
There.
This is actually not fire.
As we get these slides going on the live feed, I'll remind my colleagues that these presentations are also in your email, and they are already posted online. So, Director Scardili, if you would prefer to just start talking to the slide, it seems like it does take us a couple minutes to get to the right place because some of these decks are pretty big with different kinds of appendices and such.
Certainly, Madam Chair, I can continue. So slide 2, if you have that in front of you, just shows the summary, and I see it's up now, of where our funds are distributed throughout our department, and you'll see that pretty much 100% of our funding comes from the general fund. And as far as program distribution, just to give you some numerical context behind what's in our department, we have a budget of just over $70 million, and you can see that majority of it is in our fire suppression, EMS, and technical rescue program, with the remainder of it split between our training program and our community risk reduction program. If we could go ahead and move the slide deck to slide 4, to the first page of our fire-based cuts, that would be helpful. And I'll start speaking towards them. Before I get into any detail of our base cuts, again, just to give you some background and context in our budget of that $70 million budget, it's helpful to understand that 85% of that budget, or roughly $60 million, is in personnel, and then the remainder is split out between allocations and non-personnel or what we would call contractual and discretionary spending. Regarding our base cuts, you're going to notice that rather than go program by program, because we kind of look at the fire department, all of these cuts impact each program. We're just using one basic description for our cuts that encompass each program. So I'll briefly go through these. One of our largest cut is to non-contractual overtime. It's a reduction of $455,000. Again, to provide context for you, that's a 50% reduction in our non-contractual overtime. It will provide some challenges to the department that the chief may want to speak to later in this presentation. But to provide some historical perspective for you, going back a decade, we have not had an actual result of non-contractual overtime of less than $700,000. So reducing it to 455 definitely will provide some challenges. As far as the non-personnel reductions, they total $320,000. They will kind of be go through all of the programs. We covered a number of areas of line items of our budget of non-discretionary spending. A couple that we would highlight is we have a health fair every year for all of the members of the department where they have some medical tests. We would limit that as we are going to do in 2020 as well. We will limit that to just the OSHA mandated tests only rather than extended tests or more extensive physical tests for the members of the department. We also we have reduced our fire stores budget. So our fire stores budget covers all the supplies and everything that's needed at our 19 stations and our training facility. And we will reduce that budget also by about $50,000. And all that will really do is reduce what we keep in our inventory. We should be able to manage to that lower number. The rest of the money that is reduced through non-personnel is kind of spread through things like reductions in training, some reductions in supplies, administrative costs, those types of things. Again, we're very limited in fire into what we have control over in discretionary spending, but we've kind of shown a propensity to control those in the past, and we think we can do that in the future as well. These base cuts, as I said, kind of cover all of our programs, and that really concludes this part of the presentation. We would be open for questions or comments at this time.
Thank you, Director Scardili. Are these the end of your slides right now?
Yes, this is the end of the slides, yes.
So template ones, thank you. This is a pretty straightforward conversation, and I invite my colleagues into conversation. I'm not seeing any right at this moment. I'll just give it a minute. I do want to mention, in terms of scheduling, that we had tried to get all of the first responder units together in one day, and it seems that based on the time we took on MPD that we're not going to be able to get to 911 at this time, so we're just going to use the rest of our time for the fire department here. And just for continuity and to be able to, I think, go through all of these things is to, in a tiered way. I'm going to see if we can't get 911 into being the next presentation, if there's some extra wiggle room in our very next budget committee, but that'll be for me and I'll communicate that out. Chief Director Scardili, I'm still not seeing my colleagues in queue, so thank you. It's not to say we don't have questions about this, but sometimes information takes a little while to sink in and to digest, and I'm sure there will be follow-up conversations where we will be reaching out to the fire department accordingly. Thank you for this time. Seeing no
Thank you,
further.
Chair Palmisano, committee members. Thank you.
Yeah. Seeing no further discussion, at this point, I'm going to direct the clerk to please file both of these presentations. And I will note that our next budget committee meetings are scheduled for next Thursday, October 15th, starting at 10 a.m. and also again at 1:30 p.m. That day, we're set to hear from the Convention Center, IT, HR, Civil Rights, the City Attorney's Office, the CPED, Community Planning and Economic Development Department, and also our Health Department. With that, we've concluded all business to come before the committee today. Without objection, we will stand adjourned. Thank you.